I'm Noura Abul-Husn. I am the Vice President of Genomic Health at 23andMe. And my background is as an internist and medical geneticist who's really been thinking about the role of genetics in healthcare at large.
Excellent. Thank you, Noura. Tell me a little bit more about this genetics in healthcare, and it's been a hot topic and a lot of insights. But this is definitely your jam. Walk me through a little bit more about, I guess, the power of that in this current existing health climate.
It is definitely my jam. What's really exciting to me today about where we are and thinking about genetics and genomics and having that knowledge at our fingertips is it's just a really different story from even a decade or 5 years ago. And the reason for that is that the knowledge has evolved in such a way and the science has evolved that we understand that genetics really plays a role for everyone in every area of health, in disease, in every medical specialty, for every person, in every context, at every stage of their life. And what that means is that we can really position genetics in a different way, where it's not just being used to solve a problem, but it's being used to prevent those problems from occurring altogether.
Yeah. How would you say that the, I guess, understanding in the general public is of, I guess, the power of some of these indicators and genomics, genetics, and I guess the impact that some of those changes and interventions you can make based on some of these indications can have on their current health?
It's variable, but what we do know is that you can find genetic influences and impact across the vast majority of both rare and common diseases today. And so if you tell me about a health condition that you're interested in or that you have a family history of, then probably there is some genetic component to that. It may not be the entire story, and for most things it isn't, but it plays an important role. And what we know today is that you need that baseline information about someone's genetics to really think about what their roadmap is for health, for their healthcare trajectory, their journey. And then what you can do is layer on additional information, like knowledge about what their lifestyle is, their blood biomarkers, to see where they're at today. And then what can you actually change to impact that trajectory up or down?
I guess that's not something that traditionally we've kind of prioritized in the healthcare space, is that we're very good at doing stuff once it's happened in healthcare. And then prevention can be quite a subjective, difficult to measure and quantify topic. So I guess by leaning into some of these early indications and I guess the light switches that can be turned on and off inside your body, to be more familiar with these can be a powerful thing.
Yeah, we think it's extremely powerful, and you're right, it's not something that healthcare has traditionally focused on. We focus on treatment. So you go to the doctor most often when something is wrong and you want to fix that problem. And where genetics is poised to have the most impact is when you're healthy, and even potentially when you're first born, to just understand your health trajectory in front of you and that roadmap of health, and take those opportunities to stay healthy, to optimize health, to live not just a longer life, but a long and healthy life as much as possible.
Yeah, gotcha. And so 23andMe, obviously a fair bit of legacy in this space and a well-known name. What's the role of 23andMe at the moment in terms of, integrating some of this into the healthcare system?
Well, the most recent thing that we've done that we're really excited about is something called Total Health, which is bringing in advanced genetic sequencing to understand someone's predisposition for a number of conditions that we consider to be actionable. And what that means is that those are things that if you know someone has a genetic risk, genetic predisposition for those conditions, there's something you can do today to mitigate that risk, to avoid the problem, to prevent it. Or if you can't prevent it, to catch it as early as possible so that you have the highest chances to have a good health outcome. And so what we've done is put that together in a way that informs people really comprehensively about their genetics. And then also, because your genetics, again, gives you that roadmap, but doesn't necessarily tell me where you're at today. So we include blood testing for labs that will inform that. Like, what is your cardiometabolic health today? Yeah. And all of these are informed by expert clinical care, so that you're not just being given information, you're being told very specifically what it means, what is a comprehensive risk assessment for you, and then what is a personalized recommendation plan that I can make to make sure that you stay healthy for as long as possible.
Yeah, gotcha. And who's this particularly geared towards? Because, sometimes, I guess if we were thinking more broadly about the wellness space or even longevity or the living well space, sometimes it can be much easier to position these types of solutions to those that are not in the most need of care. So, or like the most affluent, or there's more opportunity to be able to assist at a broader scale. And if we can make these things more accessible and address issues, there's potentially a lot of benefit to hit the people that needs the most. Like, what are the kind of demographics or the people that would really benefit from something like the solutions that you're talking about to address these issues earlier on?
Ultimately, there are solutions for everyone who wants to be an active participant in their own health journey. You're right, there's not always access to that kind of information. And that's one of the things that we've seen, that genetics is just not routinely part of the healthcare picture. Most people are not being offered genetic testing unless they've come to clinical attention for a very specific reason, to be finding an etiology for a problem that they already have, for example, and we're trying to solve it. And what we need more of is just general access to knowledge that can empower people who want to be active participants in their own health journey. And that can be anyone, but I agree. I think there's a lot that we can do to improve access across the board for genetics and any new technology that we're bringing into the healthcare space, really.
Yeah, that's true. Speaking of lots of different technologies in this space, we're here at Health, and I noticed you're up on a stage, you're sharing insights with attendees. Are these the types of insights that you're sharing up on the stage? Tell me about what you've been presenting.
Well, there was a panel today that I was a participant on called Your Digital Doppelganger, and really was focusing on where the digital twin technology is today and different applications in healthcare, in the pharmaceutical industry as well. And I think it really is pertinent to what we're trying to do at 23andMe, what I think about. If you think about digital twins, that idea of a twin is, scientifically defined by having shared genetic information. And so what you want to do is really understand, if there were a digital twin of me, sharing that genetic information, that genetic makeup, and then have different lifestyles and understand what the impact is of your environment, your socioeconomic factors, and your other risk factors and other things that are happening to you in your life. The more we learn, the more we're able to understand how those different modifiable things can be manipulated to ultimately improve your health outcomes.
Yeah.
And so that's one of the things that we've been talking about here today. And in addition, just in general, where is AI taking us? And so, of course, with genetics, you have an abundance of data coming from sequencing and genotyping. And what you need is the right tools to synthesize that information with the other abundance of data coming from wearables, coming from all of the other things that we're generating today, and aggregating it and synthesizing it so it makes sense, and then delivering it in a way that people understand it and know what to do with it.
Yes.
Whether it's a patient, a consumer, or a clinician, those are the problems that we're trying to solve.